Hi, everyone, and welcome to the Community Engagement Series. My name is Priscilla Medeiros. I'm the Knowledge Mobilization and Community Engagement Specialist at the Edwin S.H. Leong Center for Healthy Children, as well as your moderator for today's session. I'm incredibly excited to introduce our speaker for today's webinar. We're joined by Dr. Timothy Ross, a scientist and director of the Engagement and Planning for Inclusive Communities Lab at Bloorview Research Institute in Toronto. He also serves as an assistant professor at the University of Toronto in Geography and Planning and the Rehabilitation Sciences Institute. His research focuses on the experiences of families with childhood disabilities, aiming to create more accessible and inclusive communities. He holds a PhD in planning from the University of Toronto and is a registered professional planner. This presentation today will explore a range of considerations, strategies, and opportunities for meaningfully engaging disabled children and their families in research and practice with a view to advancing more inclusive communities. I'd like to welcome Dr. Ross. I will now pass it over to him for his presentation.
Okay, thank you very much, Priscilla. I appreciate the introduction. I'm just going to take a moment to set up a share screen here. So bear with me. Okay, can folks see that okay?
Yes, looks great.
Thank you. Okay. Oops, sorry, I'm just making an adjustment with all the windows that I have open on my screen. Be ready in a second. Okay, I think we're okay now. Okay, good afternoon, everyone. It's certainly a pleasure to be here with all of you. And before I dive in, I just want to briefly note that if questions or topics come up during the presentation, please do by all means note them down, and I'll certainly do my best to discuss them at the end. And alternatively, please do feel free to contact me via email. That would be great too. So I just want to briefly put up the learning objectives for this talk. So my hope is that by discussing ableism, different ways to engage disabled children, and how we might think about and approach community inclusion differently going forward, that we might leave here a bit better equipped to identify and address ableism, to involve disabled children in research, and to advance greater community inclusion. So I've organized this presentation into 3 topics. I'm going to talk about ableism in our communities. So talk about what ableism is to make sure we're all on the same page, how it manifests in our communities, and then I'll zero in a little bit on ableism in play spaces because this will provide some context for some later talk about some of the inclusive playground design work that we've been doing. And then I'm going to talk about engaging disabled children. So we'll talk about arts-based research methods, their values, or why they're valuable, some of the options that are available, talk about some key considerations and strategies for meaningful engagement. And then I want to talk about some of the nitty-gritty details about getting study designs right. And then we'll wrap up with some discussion about reimagining inclusion. And I'll do this with reference to some of the inclusive playground design work we've been doing, and some questions to get us thinking a bit more about how we can imagine inclusion differently and to think about some new possibilities. All right, so starting with ableism in our communities. The image here shows a child who uses a wheelchair positioned just outside the boundary of a playground with a wood fiber surface, which isn't the most accessible surface, and they're looking toward playground equipment in the background. So what's ableism? So here we have a fairly straightforward definition of ableism, drawing on Goodley and Wolbring's work. So ableism can be understood as the favoritism for certain abilities and a corresponding negative sentiment towards or a disregard for those without these favored abilities. Now, this favoritism, I want to note, it contributes to the perpetuation of an overly normative understanding of the human body, an understanding of the body that scopes out, discounts the diversity of disability. Now, I would argue that ableism is a profoundly normalized bias in society, and that this is evidenced by the built environments, services, and systems that we have that do not adequately account for the presence or diversity of disability. So where is ableism? It's kind of everywhere. So here, what I've done is I've just listed some of the environments, services, and systems that our lab has looked into or is looking into where ableism is clearly present. Okay, I'm not going to get into all of these, but if anybody wishes to talk about these topics, we can of course do that. Okay, so some of my students may be laughing seeing this slide because I've used it on numerous occasions. And frankly, the data is getting a bit old. This is from 2017, so keep that in mind. But I include it because it's a useful slide in terms of helping folks to, give their heads a shake and question just how wildly normalized ableism remains. And I say this because along the top row here, we have all of the stations within the public transit networks of 3 global cities. And along the bottom, we have just the accessible stations within these cities' transit networks. Again, this is 2017, but it does indicate some stark differences, which I would say shows the extent to which disabled people have been ignored in the planning, design, and building of transit spaces, even though these spaces are essential to the mobility, health, and well-being of so many people in their everyday lives. And I'll ask, that we pause and just take a moment to ponder, how frequently do we actually hear about these global cities having exclusionary transit systems? Okay, despite the importance of these systems. And what does this mean for our cultural norms or our expectations for how accessible our environments need to be or should be? Okay, how many people use public transit stations without questioning that this is a system that's exclusionary? So the transit maps kind of offered some macro level insight into ableism's presence. I want to go a bit more micro level, I suppose, by looking at some built environments that we encounter. Just some examples. So in the top left, we have a child and a parent who uses a wheelchair, and they can't access the swings due to a raised barrier around the swing area. Then we have a sign showing accessible washrooms on some floors, but not all, meaning we're at times asking those who require accessible washroom designs to do more work to use the washroom than others. Then we have wayfinding signage inserted into the middle of a sidewalk here in Toronto that someone who's walking can kind of duck around, but someone who's using a mobility device would be blocked. Then we have a very small airplane washroom with seemingly no turning radius that would be inaccessible to many. And in the bottom left and bottom center images, we can observe ableist service designs. Okay, first, waste bins. I mean, this is kind of normal, where we have waste bins situated on sidewalks that can temporarily block wheelchair users and cause them to perform pedestrian travel on the street, such as this individual here. And then we have snowplow services placing excess snow in accessible parking spaces, which is, in my opinion, the last place it should be placed. Apologies, I'm recovering from something. And in the bottom right, we have another air travel example with narrow aisles that demand some disabled people to be separated from their mobility devices, which creates opportunity for these devices to be damaged or to be lost during the travel, which has been a very serious issue. Okay, so in our lab, we've done a fair bit of work on inclusive play, and I'll offer some context on that soon. But for now, I just want to talk about ableism's influence on the design and operation of playgrounds and how it causes some children to be excluded from playground play and thus the benefits of play. For example, the opportunities to develop physical, social, and problem-solving skills, to experience social interaction, with family members and peers, to learn about risk-taking, having opportunities to challenge yourself, having opportunities to engage your imagination, having opportunities to independently select what play activities you want to do. So these are important benefits. And for this reason, I would argue that playgrounds are undeniably a remarkably important childhood space. Now, ableist, inaccessible playground designs persist. As I've said to numerous people on numerous occasions, any playground that you spot with a sand or pea gravel surface is indicating to any child or adult who uses a mobility device that this play space and all of its play opportunities are not for them. Now, ableist play environments, they cause lost opportunities for families of disabled children or families with adults living with disability. Lost opportunities to play together and strengthen family relations and to enjoy playgrounds as third place experiences. Now, just very briefly by third place, I'm not going to deep dive into that, but I'm talking about Oldenburg's thinking here, where he notes that we need third places beyond our home and work, or for children, school. We need places where we can have spontaneous, informal interactions with members of our community that contribute to our mental health, well-being, and our sense of community cohesion. It's part of inclusion. And playgrounds can serve as invaluable third places in our communities. They're kind of perfect for that, but we've got to make sure that everyone can easily access and use them. Lastly, I'll note, if disabled people can't be present at a playground, it's obviously like it is a loss for them, but it's also a loss for the community because they're losing out on the diversity of disability. The community's losing opportunities to understand, interact with, learn about, or appreciate the diversity of disability because those who are disabled cannot be present. Okay, so this is a community loss that I think needs to be taken quite seriously going forward. So I found this short quote from Jay Dolmage to be impactful, just in noting too often we react to diversity instead of planning for it. And we're doing this with planning and designing communities for disabled children. First, we at times ignore children's needs due to adultist thinking about space and place. And secondly, we at times gloss over the diversity of disability and planning work. So there's this double exclusion almost for some disabled children. Now, I include this quote here just in hopes of encouraging some reflection on the fact that, one, this happens and happens often, but also, two, when we don't plan for the diversity of disability, it often leaves disabled people and advocacy groups to carry out inequitable work to get things changed. And I'll add that from a practical perspective, when we have to react to the diversity of disability by going back to a project to make things accessible and inclusive, it can be costly and yield lesser designs. So we've got a lot of work to do in terms of identifying and addressing ableism at the outset of projects to get things right and to avoid, having to go back and fix things. So before we move on to the topic of engaging disabled children, I want to speak briefly about engaging ableism. So to do this, to address ableism, we must identify, question, and unsettle its normalcy in many areas and at different levels. So at an individual level, we must question our own biases. We all have ableist biases. We just do. But question our biases, attitudes, and actions, and how they may permit ableism to persist and to get reproduced in the work that we do. Organizationally, we must question normalized practices and arrangements that may foist inequitable access labor onto disabled children and their families. This happens in education, healthcare, and urban planning. We've covered some of the norms in our environment, systems, and services. And I'll note education and training and language. These are also areas that require a lot of questioning. I cannot dive into these last three bullets, questioning project scopes, the different types of inequitable access work, and the disability perspectives that we're using, but I'd be happy to talk about that afterward. Apologies. Okay, engaging disabled children. The image here shows a smiling child with a hearing impairment completing an arts activity with some support from an adult. Okay, so I want to talk about the value of arts-based or arts-informed research methods and why they're useful when working with disabled children and their families. So more and more frequently in our lab, we're using these methods to understand how disabled children and their families experience specific community environments. For example, we've used them to look at school travel and pediatric healthcare experiences. And now we're using them to explore supportive housing experiences, as well as how autistic students are experiencing schoolyard designs. Now, to the right of this slide, I included 2 art products from a project exploring how racialized disabled children and their families experience pediatric healthcare services. I think these images serve as good examples of how art can offer insight into emotional aspects of disabled children's experiences. At the top right, we have a portraiture activity product showing an angry, frustrated face with the words noting, "Do you hear me? Are you listening to me? Do you see me? I need your help." And to the bottom right, we have a drawing of a leech with words noting, "I feel like a leech," and this references how they are feeling in relation to the pediatric healthcare system. Both clearly indicate serious issues in how disabled children experience healthcare, especially emotionally. And I would argue, that having art products emerge from studies actually creates some opportunities to enhance reports and peer-reviewed publications and other study outputs due to the feelings they can produce. Now, providing disabled children with art activities as an alternative means of communicating views creates, possibly necessary opportunities for engagement and meaningful data collection. Some children are more comfortable communicating via artistic forms than they are spoken word, and some love to talk about their art products. So it makes good sense to provide these options to understand their experiences. And I'll add that, if a participant doesn't produce a magnificent art piece, I mean, the quality of their piece isn't my key concern. But what I want to say is, if they don't produce a terrific art piece, or maybe they don't even love the artistic process. This happens. Participants are different, of course. But there's still value in carrying out these activities prior to interviews because it does a terrific job of getting disabled children and their families thinking about the topic at hand well in advance of the interview. So their issues and experiences and ideas are already percolating when they arrive at the interview, which can help to enrich data, obviously. Now, at this point, in pretty much all cases in our lab, we are not solely seeking to understand disabled child participants' experiences. We directly seek to understand their critical perspectives, their ideas as well. Now, we do this to acknowledge disabled children's agency, their unique positionalities, and the fact that they have expertise on how they want their worlds to be. So if they have critical input on how to change things to enhance their accessibility, inclusion, or their joy, why not ask them for their ideas in addition to their experiences? Okay. I mention this because if we focus and zero in just on their experiences, we may get some of their ideas, but we also may not. So by explicitly asking about ideas, you create some really interesting and exciting analytical opportunities and opportunities to voice what they think and what they want. Now, lastly noted, we approach childhood disability experiences as a family experience. So yes, disabled children experience disability in their own way, but families are experiencing it too. Okay, they also experience accessibility and inclusion issues. They perform inequitable work to gain access to services and systems. They feel negative attitudes and the negative impacts of ableist institutional arrangements and so on. So in many cases, we do extend arts activities to parents We haven't done much with siblings, but that's something that's on our radar now. But in extending these art activities to other family members, it can lead to some really invaluable insights. Okay, so I wanted to briefly note some of the arts methods that are out there for consideration. And I'll note that these methods they should be selected and tailored based on research questions and study populations. And to the right, I just thought I'd include 3 more art pieces. The top one showing numerous speech bubbles with excerpts like, "She's faking it," "It's growing pains," "Why are you doing this to your mom?" You know, showing what some racialized disabled children are hearing from healthcare practitioners, and speaks to problematic interactions between them. And the bottom 2, both of which show messy, windy paths to navigate healthcare, speak to the work and confusion involved in finding the help they need. Yeah. Okay, so something I've not spoken about much so far, but which is feeding into our research more and more, is involving disabled children and youth and their parents in the design of research questions, materials, processes, and dissemination. At Holland Bloorview, such processes can involve consultations with our Youth Advisory Council, the Research Family Engagement Committee, or requesting to have family leaders assigned to your project for ongoing input. Now, this can be invaluable in terms of making sure you're asking the right questions, that your study materials and processes are streamlined and respectful of the requirements, preferences, and time of disabled children and their families. And it's also been helpful in terms of ensuring compensation options adequately reflect the value of families' time and input. After all, we can't do these studies without their input. On the topic of dissemination, I just want to note that I find producing art products through research does present some exciting opportunities for dissemination. The top left image here is a photo of a public 2-week art exhibit we held showing participant art in an art gallery here in Toronto. We actually held an opening event and invited a lot of the participants. Many of them came to join to celebrate their art and to contribute to the discussion. And then the top right image, we actually adjusted the display, the exhibit, so that we could show the art in a high traffic area at Holland Bloorview Kids Rehabilitation Hospital. And the bottom center image, this is a YouTube screenshot of a series of Holland Bloorview welcome tour videos that was created by Holland Bloorview patients for new patients. So they made the decisions about what to show, what to video, what to say. They narrated it. While we facilitated their decision-making and supported the editing and some of the communications on the back end. Okay. So in talking about engaging disabled children, I thought I'd note this chapter and article about the study design approach and pilot study findings for a project focused on disabled children's school travel experiences. The chapter emphasizes 3 key considerations for advancing inclusive research designs for engaging disabled children, while the article presents a series of very specific lessons learned from piloting technologies in our data collection process. So in the chapter, I discuss how arts-based methods aren't necessarily enough to ensure inclusive participation, as some disabled children will, of course, require some support from staff or family members or enabling technologies. And I discuss how we must proactively question if such technologies are required at the study design stage. So for this study, which involved photo voice to photograph their school journeys, it was determined that we would need to provide adaptive photo kits for children, and the participants had osteogenesis imperfecta, Duchenne muscular dystrophy, and spinal muscular atrophy. So we prepared these kits. And in partnership with a company called Tekla, we developed and piloted a mobile device to wheelchair clamp that would withstand the bumps of school travel and provide the necessary micro adjustments for photo taking. It was a bit of a process, but it was worthwhile. Now, without this adaptive photo kit, disabled child participants would have been more likely to become frustrated with participating, or they may not have participated, or it could have led to photo taking by proxy, as their parents may have taken the photos, influenced the photos taken, and possibly obscured the children's experiences and views. Now, crafting this kit was also geared toward ensuring positive participation experiences, which we emphasize in our projects. And we view this as quite important given some of the history of disabled people's research participation. So to ensure positive participation experiences, we asked, is their participation as convenient as possible? To address this, the researcher went to their homes when it was convenient to them and not for the researcher, and rescheduled as the families needed. Also asked, is participation work intensive and time consuming? And if so, are they adequately compensated? This led to a bit of a research ethics issue in some cases, because the desire was to compensate families with $250 gift cards based on $50 an hour for 5 hours. And this was a bit beyond the typical amounts at the time. I won't get into that too much, but I will note we are at a time where recruitment compensation amounts warrant questioning such that they adequately account for the value of their time and input, not to mention inflation. And I'll mention it. One small practice that we do in our lab that, details matter, is that we always offer at least 5 gift card options so that participants can maximize their benefit of participating by tailoring the card they receive to what they require or prefer. And it's no challenge for researchers just to go onto another site to purchase and email the gift card that way. Okay, so adequate representation via researcher reflexivity. So any qualitative researcher knows that and it's integral to including disabled children and their parents in research. Because even if they can participate with inclusive or enabling technologies and their participation experiences are positive, a lack of reflexivity among the researcher may lead to them unwittingly dismissing or misrepresenting the children's experiences, views, and ideas. Okay, this can happen through unchecked biases, using methods that suit researchers more so than the children, and researchers privileging their own voices over participant voices when they're reporting the findings. So incorporating reflexivity throughout the study design, data collection, analysis, and reporting is imperative. It's not optional. For ensuring that researchers are respecting and accepting disabled children's sense-making as their own reality, and ensuring that researchers are focused on faithfully representing the participants' understandings, experiences, and ideas. Okay. There are a couple of reflexivity practices that we use. I can't dig into them right now due to timing, but I'd be happy to chat about those. Oh, yes, I included this slide. These are just figures from the article and chapter noted on the previous slide. The top left shows 3 clamps we went through our piloting process to get the right technology. The bottom left shows the adaptive photo kit we created. And in the article, we speak to these 3 images on the right with respect to how we underwent piloting the activity instructions and the clamp. So yeah, details matter, obviously. And here I've noted just some detailed practices, considerations, and lessons learned as food for thought. You can take them or leave them. I hope some might be helpful. So I maintain that flexible scheduling is key. You must remain flexible to adjust to families' scheduling challenges, of course, but you also do not want to tightly schedule data collection because, one, data collection is mentally fatiguing, and you really do want to be sharp for every data collection event. And secondly, if you schedule too tightly, you may miss out on important opportunities. So extended periods for rapport building before interviews with disabled children have been invaluable in some of our studies. When I've collected data, you can't tell on Zoom, but I'm a very tall person. Uh, you know, in one case, it was quite surprising to a child, and so we actually had an extended rapport building period. I ate lunch with the family and so on. Uh, but you know, all children are different, and sometimes extra rapport building time is needed. So having scheduling flexibility um, gives you the opportunity to do that and to enrich your data. It also gives you the opportunity to extend interviews if it suits the families. They want to talk more. I mean, keep going. Uh, and having the flexibility also allows researchers to schedule or to carry out some reflexivity practices immediately after data collection while the events and how it unfolded, it's fresh in their minds. Okay, so opportunity to check in on their biases. What worked and what didn't? Should questions be adjusted in the guide? Are there things we can do to improve the data collection process going forward? Also in our lab, note, we're now typically offering a suite of arts activities for data collection rather than just one. And we do this to help account for the fact that people have different levels of comfort with the arts and may in turn want to engage in different activities. So offering multiple options can enhance participation. So a child or parent participant may not want to write a poem, but maybe they would love to do a photo activity. Or someone may love to write a poem and could produce something really rich and meaningful. So providing some flexibility there has been a useful practice for us. Proactive issues prevention is another good practice. The example that comes to mind is we emphasize to parents that we want to understand their children's perspectives on numerous occasions, at all touch points, really. So initial contact, consent and assent processes, and immediately before interviews. And I view this as a proactive approach because in some cases, and it does happen, where parents remain present during data collection, when you're collecting data with children, and they may start to speak and respond on the children's behalf. They may not be comfortable with a gap between a question and an answer, and they fill in the space at the time. But if you've mentioned it numerous times, you're then much better positioned to nudge back a little bit and say, oh, I appreciate your input and support with the data collection. But as we've discussed, a big part of our study design is aimed at understanding your child's viewpoint. So I'd love to hear their voice here. So I just mentioned that because if you've mentioned it on numerous occasions, you're in better shape than telling them to pipe down for the first time. I shouldn't have said pipe down, but I hope you understand that. Anyway, it's just been a useful tactic for us. Post-interview reflexivity, I think I mentioned that. Just good practice to block out 30 minutes after interviews to question what worked and what didn't, how you're relating to participants and the data, interview guide adjustments, what issues were new and which ones were repeated in terms of data saturation. And then to just assess your understanding of participants' viewpoints and where you're at with addressing research questions. Another practice that's been useful is kind of incorporating reflexivity discussions with another team member, drawing on Cole and McCutcheon's kitchen table reflexivity approach. This has also been quite helpful. Lastly, I include this Eames quote for some contemplation. The details are not the details, they make the design. Just to suggest that all details matter. Some will make a big difference and they will be very tangible, and some won't. But those that don't, when you combine them together with, other details, they can make the difference between a negative or an average or a great participation experience, and in turn affect the richness of your data. So yeah, I know we talk a lot about details to the point that, when we're crafting interview guides, um, when we arrive at a point where we don't want to look at the guides anymore, or we almost dislike the guide, that means we've been highly detailed and we're at a place now where we're pretty much good to go for the study. Okay, so reimagining inclusion. The image here shows an accessible merry-go-round being used by numerous children, one of whom is using an electric wheelchair. So I do want to talk about inclusive playgrounds. Now, these playgrounds account for all children's right to play. They exceed minimum accessibility requirements. They support various play types and challenge levels, and they offer health and well-being benefits to all. Now, the push for inclusive playgrounds in recent years is a welcome change. But we really have to keep pushing to make these playgrounds the norm and not the exception. As inaccessible playgrounds, they do continue to be built. And beyond providing the benefits of play to disabled children and their families, these playgrounds create opportunities for us to, look at the designs, question them, and to unsettle normative community understandings of disability as excludable. Now, in stating this, I mean that sometimes our approach to disability inclusion is half-hearted. And as a result, it can result in spaces that allow for the presence of disabled people, but not necessarily their full participation. Drawing on Tanya Tichkowski's phrasing, she notes, disabled people are at times included as an excludable type, and this must stop. And I do view inclusive playgrounds as potential third places, community hubs, as an opportunity to ask some questions about disability as excludable, and to kind of address that issue. So how do we keep pushing for inclusive playgrounds? To help with this, we crafted an inclusive playground design resource titled Creating Inclusive Playgrounds, a playbook of considerations and strategies. It's informed by a review of 125 inclusive playground design resources collected from practitioners around the world and online searches. It's available in French and English on the websites of Canadian Tire Jumpstart Charities and Holland Bloorview Kids Rehabilitation Hospital. This figure from the playbook's introduction outlines how we structured the resource around 4 key design questions. How do we start? Can I get there? Can I play? And can I stay? These questions are helpful for guiding inclusive playground design processes, and possibly also useful for thinking about the planning and design processes for other community spaces. And I say this because these questions help to question the typical scope of projects. And in so doing, they can help us to do more in terms of accounting for the actual lived experiences of families of disabled children. So that is, for example, in the case of this resource, rather than producing a resource squarely focused on what is within the boundaries of the playground, so just talking about the playground surface and the equipment selection, this resource considers how can we make it easier for disabled children and their families to get to the playground and to stay at the playground, okay, by considering pathways, parking, facilities and amenities around the playground. So I mention this just because going forward, my hope is that we can start to question project scopes with greater care and in ways that more meaningfully account for disabled people's experiences and requirements. Okay, that we can't just focus on what's in the boundary. There's the issues of getting to and from these locations and staying there as well. Okay. This figure comes from the How Do We Start section. We note that community engagement must be emphasized from the start. And I'm not going to list all of the practices noted, but I'll note that we are taking a cue here from research by calling for the use of child and youth advisory committees for projects and the inclusion of child-friendly activities and consultation events, for example. I note this just because I'm starting to ask more questions. I hope other people start to do more as well about what lessons the built environment professions, okay, planners, designers, architects, developers, engineers. What lessons can they take away from inclusive qualitative research methods? Okay, so arts-based research methods, interviews, reflexivity practices, co-creation, and so on. What lessons can they take away from inclusive qualitative research methods to enhance practice and, in turn, advance more inclusive communities? I'm going to skip this slide. It shows evidence-informed recommendations for inclusive playground design based on a scoping review we conducted, led by Denver Brown. We can revisit this. And this shows recommendations for advancing inclusive playground surroundings. Now, I did want to show some images of inclusive playground equipment, just for context, to get us thinking about inclusion possibilities. So here we have a communication board for non-speaking children that can be added to playgrounds. And we have a color counting wheel activity. And then we have railed, elevated pathways, one that undulates and one that goes side to side, that I think is exciting in terms of thinking about how we might, leverage inclusive play infrastructure for rehabilitation programming. And across the bottom, we have a merry-go-round and two different swing types, a saucer swing and a harness swing. I'll quickly note, I love the idea of communication boards, which has come up over the past, I guess, 3 or 4 years. This is a low-cost piece that can be affixed to playground equipment or around the perimeter, and help to create opportunities for non-speaking children to interact with and feel included among their peers, or to just experience joy with their families. So it's a really nice piece that I hope gets added to all playgrounds. And here at the top left, we have a double wide ramp on the left to an elevated play structure like the one on the right. The double width allows 2 wheelchair users to travel side by side or to pass one another with ease. And then we have equipment for exercise in the bottom left that can be incorporated into playgrounds or near playgrounds to create some unique intergenerational opportunities. And then we have an accessible merry-go-round and a child playing with a color wheel play panel. So, right, okay, this slide. So I just included a few questions that were on my mind this morning. How can we get built environment practitioners to consistently think about disability and engage disabled people with more forethought and to not approach it as an afterthought? The top 2 articles both speak to this, or are looking at the planning profession and how they're approaching disability and accessibility. If anybody's curious about it, one is not published yet, but was accepted 2 days ago. Can research or reflexivity practices be applied or useful in practice? I think there are some interesting opportunities there. And just what ways, how can we do more to involve disabled children and their families in community planning and design? The fourth one is a new research area for us. How can we advance more inclusive and playful pediatric healthcare environments for disabled children and their families? Okay, we've done 2 reviews on this topic and are looking to do more research on play in pediatric healthcare. With this last question, just thinking a bit about how we might tailor arts-based methods to engage disabled children and their families with respect to their design thinking, like really get at their critical perspective. So these are some things on my mind right now that I thought I'd share. Okay, so I'm going to wrap up now by taking a moment to imagine some possibilities for childhood disability inclusion in our communities. So regarding inclusive play, we clearly have a unique opportunity to advocate for and advance change to make inclusively designed playgrounds the new norm. This is certainly exciting, given their potential to positively influence childhoods. And we also have opportunities to leverage inclusive play infrastructure and to diversify its usage through designs that support innovative play programming options, for example, related to rehabilitation or education or just straight up facilitated play. And might we Also incorporate intergenerational equipment, as shown earlier, to support the well-being of older adults? And could we advance playground designs and programs such that playgrounds serve as central third places for disabled and non-disabled children and their families? And we'll go further for a second. It's kind of a big question, but why are we restricting play opportunities um, to playgrounds and leaving so many community environments without play? Why are we leaving so many spaces with ableist and adultist designs? So I'm talking about pedestrian realms and streetscapes whose designers never even thought of a child, youth, or an adult play as a possibility. So could we add sensory play options into the pedestrian realm? For example, play walls that don't necessarily impede pedestrian flows, but invite children into these spaces? Or could we add inclusive play components below storefront windows, unused spaces along busy retail streets? Or could we advance playful scavenger hunts like Mice on Main Street in Greenville, South Carolina? It's worth a Google. Consider checking that out. And could we add inclusive play components to school zones to help encourage active school travel and improve children's health? And to include disabled children in active school travel programs and possibilities, as disabled children have been, in many cases, imagined out of active school travel. So I throw out these questions or these possibilities in hopes that this might spark thinking about these topics and how we can, should, and I mean really must do so much more. I'll throw one more point out there concerning pediatric healthcare. Can we engage disabled children and their families more meaningfully in pediatric healthcare center design projects, renovations, additions, new builds, whatever, to advance much improved care spaces well beyond what is currently provided? Regarding play, could we make it so that it is expected that almost all children's health centers have playgrounds, inclusive playgrounds, obviously, just like we expect playgrounds in schoolyards and parks? And could these playgrounds then be closely tied to innovative occupational therapy, physiotherapy, and therapeutic play programming? Okay. Yeah, and just as we're questioning the boundaries of play in the pedestrian realm earlier, could we expand play options in pediatric healthcare centers beyond playrooms or gardens? Could we incorporate playful elements into inpatient rooms and along the walls and hallways? I'm not sure, but investigating. Okay, I'll wrap up. I'm realizing the time. At the end of the day, to advance more inclusive communities for families living with childhood disability, whether we're talking about play spaces, education, transportation, or healthcare, we must all do more to continuously question and unsettle how we're conceptualizing disability, childhood disability, uh, and we must do more to involve disabled children and their families in research and practice, I think. So reflecting on your understanding of disability, your own ableist biases, we all have them, along with greater engagement with disabled children and their families, and a strong commitment to unsettling normalized ableism and reimagining inclusion. These are good places to start this work. So that's it for me. Thank you all very much for your time.
Thank you so much, Dr. Ross, for an incredible presentation. I'm very appreciative to just the level of photographs and imagery that you included in your presentation. It was incredible to see the types of structures that do exist within communities to increase accessibility. I noticed in the comments we had one question about where are these parks located. I too am quite interested to know where these parks are located geographically. I noticed in one photo there was a woman with a USA sweatshirt. I wasn't sure if that was an indicator of where perhaps this may be located.
Yeah, so I mean, some of the photos are from the U.S. Some have come from my colleague Ingrid Canix, who does inclusive playground design. And quite a few of them are also of some of the Canadian Tire Jumpstart playgrounds that have been built across every province and territory now in Canada. Um, I, I forget the website, but whoever had that question, if you email me, I know I have received someone did produce a website that actually maps out all of these inclusive playgrounds, so I can track that down and provide that.
That's fantastic. I do want to mention this is the time that if anyone has any questions they would like to raise to Dr. Ross, to please feel free to raise your virtual hand. You're certainly also welcome to add your questions in the chat, and I certainly bring that to his attention. So give you a moment or so to gather your thoughts, but again, please raise your hands for this point of question. While we wait for others, I do have a question of my own that I'd like to pose. I was hoping you could speak a little bit more about how design choices within community spaces, such as the ones you've just shown us today, directly kind of affect and impact the health and well-being of children that you're working with and their families. You had mentioned, towards the tail end of the presentation, this notion of therapeutic play programming, but is there anything else that you can offer up to this group?
Yeah. So first off, I mean, our design choices, I mean, they impact everyone's health and well-being and their mobility, regardless of what space we're talking about, I think. If, for example, if we have inaccessible public transit and inaccessible housing, that can constrain people's ability to get to and from where they want to be or the area they want to live in close proximity to green space or to work or schools and so on. So the time and effort required to get our designs right is worth it. I think we've relied on, Band-Aid solutions of retrofitting spaces for a bit too long. It's not cost effective and often leads to lesser designs. So, it's got to get addressed. And I'll add that, I've had some discussions recently about getting the design right is key, of course, but that's just kind of the foundation. I think there's more opportunity to look to programming to activate spaces. I'm really quite curious about, if we have this inclusive play infrastructure and we're spreading it out across communities, could they serve, perhaps through scheduling some specific times for education or rehabilitation options? Because, through some preliminary research, we know that children, whether it's in education or in rehabilitation, they respond quite well in child-oriented settings like playgrounds. I hope that kind of answers the question a little bit.
Yes, I do see we have a raised hand here as well. Lise, would you like to unmute yourself?
Yes, can you hear me?
Yeah, hi, Lise.
Hi. So I put my question in the chat, but it hasn't been read yet. I was hoping it could be read while the talk is still going.
I'll take a look at it, Lise.
It's about the consultations the City of Toronto is undertaking right now about this very topic, but it doesn't stress accessibility.
Yeah. Okay. Thank you for raising that. So obviously, some discussions are needed about emphasizing, accessibility and inclusive design with whoever's leading this project. But I'm going to speak for a moment, Lise, to what's, perhaps a systemic issue. And that is, in some of the research that we've done looking at the planning profession, that we've got some pretty serious issues with respect to disability representation in the planning field, and also disability education in planning. And so I think, for consultations to be held like this, without much attention to disability and accessibility is a problem that's kind of coming out of education programming that's not paying as much attention to disability and accessibility. Having said that, the City of Toronto is going to listen to voices and should respond to issues that are raised among the public who attend these events and contribute. So I may look into this myself.
Yes, it would be great if you could do a presentation to them or get them somehow to involve your information.
Yeah. Yeah,
Because it's
thank you.
going to be all these small consultations and people doing a survey, but if your voice could be bigger than that, that would be great.
Yeah, I'll look into it, Lise, and we'll follow up.
Thank you.
Yeah.
Thank you very much, Lisa, for that question. I also spotted a question in our chat from Carla, curious about whether government grants exist to make spaces more inclusive, i.e. for businesses, schools, etc.
Yeah, I know that there are grants out there. I apologize, I don't have them off the top of my head. But there are grants for this, some from the government, some from nonprofit organizations or foundations. I believe I might have to go back and look into the Inclusive Playgrounds playbook. But I think I have a list. So if you do follow up with me with an email, I'll try to find that list and get you some more information. And I will note that fundraising is incorporated into that Inclusive Playground Design resource, the playbook. We do talk about that in the How Do We Start section.
Perfect. We have just a few more moments of the webinar left. If there are any additional questions, as I mentioned, please feel free to raise your virtual hand or pop a question into the chat. Something that I was hoping you could actually define for those on the call is third place. You had mentioned it in your presentation, and I was trying to do a quick search.
Yeah, so it's an older concept. I'm trying to recall the date of Ray Oldenburg's books. It's like late 80s or the early 90s, maybe, actually, when this was written about. But just exploring community cohesion, and I would, in doing so, speaking about feeling included in our communities and how, we all have our first and second places. Well, not all, but with respect to, you have your home and you have your workplace, or for children, they have their school. But part of feeling like a community and feeling included, there's a lot of value in us having third places. And there's some discussion about this now that with our, social media, our growing virtual presence, the time we spend on our phones, that we're not spending as much time in third places where we can, where anybody can access these spaces, where you can feel community cohesion, where you can informally interact and get to know people, learn about people. And I don't like that we're losing those places. And I do envision, if we design playgrounds inclusively, we can, use those as communities' third places. And that can create some really important opportunities to feel included in communities and for communities to learn about disability by having those interaction opportunities. So that's kind of where that thinking is coming from.
Perfect. Well, thank you so much for clarifying that. I'd like to thank everyone for joining us today, especially yourself, Dr. Ross, for joining us at the Community Engagement Series. It was incredible to learn more about your work. And of course, if there are any additional questions that folks on the call may have in relation to this presentation and the work that Dr. Ross leads, as well as his lab team, please feel free to reach out to him. His contact information is still on the screen and will be circulated after today's presentation. And lastly, I look forward to seeing you all at our next Community Engagement Series in November. Please stay tuned for more information. Have a great day. Bye-bye, everyone.
Thanks, everybody.